Can urodynamic studies detect prostate obstruction? Have you ever wondered how doctors figure out if there is a blockage in the urinary tract caused by prostate issues? Urodynamic studies are a key tool in this process. These tests assess how well the bladder and urethra are functioning and can help identify bladder outlet obstruction, often linked to prostate enlargement or other conditions. Urodynamic testing involves a series of measurements that evaluate how effectively the bladder stores and empties urine. When it comes to prostate obstruction, which is frequently due to benign prostatic hyperplasia, these studies are crucial. They help determine if the enlargement of the prostate is causing a blockage that affects urine flow. This is important because symptoms like difficulty urinating, a weak stream, or feeling like the bladder is not fully empty can arise from various issues. Urodynamic studies can help distinguish obstruction from other bladder dysfunctions. One of the key components of urodynamic evaluation is pressure flow studies. These measure the pressure generated by the bladder muscle during urination and the rate at which urine flows. If the bladder pressure is high while the flow rate is low, this often indicates a blockage from the prostate. This relationship is quantified by the bladder outlet obstruction index. Values above a certain threshold suggest significant obstruction. Another important test is the urinary flow rate test, also known as uroflowmetry. This non-invasive test measures how fast and in what pattern urine flows. A reduced flow rate might suggest obstruction, but it is not definitive on its own. Additionally, measuring post-void residual volume is essential. This involves using ultrasound to see how much urine remains in the bladder after a person has tried to empty it. A high residual volume can indicate either obstruction or poor bladder muscle function. Research shows that patients with confirmed bladder outlet obstruction due to prostate enlargement often have better outcomes after surgical treatments, such as transurethral resection of the prostate, compared to those without obstruction. This highlights that urodynamic studies not only detect obstruction but also help predict which patients may benefit most from surgery. However, it is crucial to understand that not everyone with lower urinary tract symptoms has an obstruction. Some individuals may have bladder muscle dysfunction or other causes. Urodynamic studies can differentiate these conditions, which helps avoid unnecessary surgeries for those who do not have an obstruction. In summary, urodynamic studies are considered the most accurate method for diagnosing bladder outlet obstruction caused by prostate enlargement. They provide objective data that guides diagnosis, treatment decisions, and prognosis for men experiencing urinary symptoms related to the prostate. While these tests are invaluable, they are typically reserved for more complex cases or when initial evaluations do not provide clear answers. Always consult with a healthcare professional for personalized medical advice.